What are the most common methods for bladder diagnosis? When it comes to diagnosing bladder conditions, there are several common methods that healthcare professionals use. These methods help identify issues like bladder infections, control problems, and even bladder cancer. The process usually starts with a thorough medical history and a physical examination. During this initial step, doctors will ask about your symptoms and any relevant medical or family history. They may also conduct a physical exam, which can include a stress test to see if there is any urine leakage when you cough with a full bladder. Next, laboratory tests play a crucial role in diagnosis. A urinalysis is often performed to check for blood, white blood cells, or signs of infection in the urine. If an infection is suspected, a urine culture may be done to identify the specific bacteria causing the issue, which helps guide treatment. Blood tests can also be important, as they assess kidney function and can reveal more serious infections or chemical imbalances. For those experiencing urinary incontinence, keeping a bladder diary can be very helpful. This diary records fluid intake, urination times, volumes, and any leakage episodes. By tracking these details, patterns and potential triggers can be identified, aiding in diagnosis. Imaging tests are another key component of bladder diagnosis. These tests visualize the urinary tract to detect any abnormalities, such as kidney stones or tumors. Common imaging methods include ultrasound, computed tomography scans, magnetic resonance imaging, and X-rays. One of the most definitive methods for diagnosing bladder conditions is cystoscopy. This procedure involves inserting a cystoscope, a thin and flexible tube with a camera, through the urethra to directly inspect the bladder and urethra. Cystoscopy is particularly essential for diagnosing bladder cancer, as it allows doctors to see tumors, inflammation, or other abnormalities firsthand. Urodynamic testing is also used to evaluate how well the bladder and urethra store and releases urine. A common test in this category is cystometry, which measures bladder pressure during filling and emptying. This test often uses catheters equipped with pressure sensors. Electromyography may also be employed to assess the activity of pelvic floor muscles. These tests are valuable for diagnosing causes of urinary incontinence and other bladder dysfunctions. If bladder cancer is diagnosed, additional imaging tests like positron emission tomography scans, bone scans, or chest X-rays may be performed to determine if the cancer has spread to other areas. In summary, diagnosing bladder conditions involves a stepwise approach. It starts with a medical history and physical examination, followed by urine and blood tests. Imaging and direct visualization through cystoscopy, along with specialized functional tests like urodynamics, provide a comprehensive evaluation. This thorough process helps healthcare professionals identify infections, structural abnormalities, functional disorders, and cancers of the bladder, guiding appropriate treatment decisions. Always consult with a healthcare professional for personalized advice and information regarding bladder health.